How have you found being in a leadership position and coordinating these efforts? Is it relatively new for you? Have you been doing similar efforts for a long time?
It is relatively new for me. I tend to be a much more behind the scenes person. I like to make the things happen, not necessarily be on stage while they're happening.
Respect that.
But I'm also like trying to own my experience and be like, okay, maybe this can help someone else, and maybe we can help someone else. You know, I had someone reach out to me recently and we were talking through what they were going through, and they're just like, I don't even know where to go with this. I don't know what to do. It went back to they were a racial minority and a gender minority, and they were kind of getting dismissed. And I was like, okay, this is the strongly worded email we're writing. And it got them the MRI and it got them a diagnosis. And it got them a diagnosis possibly 5 or 7 years before they would have had one. That means the world to me, you know, getting to be there with this person and going, okay, we at least have an answer. And you're not going through this by yourself. Yes, this role in the ERG is kind of new to me in many ways, but at the same time, it still feels a lot like being back in the ER, you know, and listening to people and going, okay, I hear what you're saying. Here's what we're going to do. I was in triage one night. I noticed a battle sign on a small child, which is bruising behind the ear, and it's indicative of a basilar skull fracture. Mm-hmm. It's a really subtle sign, but being able to see that and go, all right, head of the line we go. This is being part of the ERG and getting to hear from people what's going on and being able to go, okay, head of the line we go with this problem because this really needs sorting. It's a familiar territory, even if the role itself is a little new to me.
Right, you're still triaging and prioritizing.
And having the ability to go, this is really a problem.
Level 1.
Level 1, yeah.
There's an emergency. I like how the ERGs are also just a source of, you know,
camaraderie.
A place for people to vent a little and validate their own experiences. Like, it's so valuable to just feel like I'm not the only one who's frustrated by this, or I'm not the only one who's been told this inappropriately. Even that, I feel like, is big progress. It's like, okay, someone else is willing to say you were mistreated or this was not okay.
This could have been handled better. Let's help. Yeah.
You're reminding me of something you said earlier when how frustrating it's been to have to pitch yourself as a reasonable person, as a, you know, insightful, level-headed person. I mean, of course you are, but having to put conscious effort into that with each healthcare interaction because you know it can so quickly turn against you if you're perceived a certain way. And then at the same time, you're also tasked with the burden of like showing your healthcare providers how they can best help you because they're probably not as knowledgeable as you, or they're facing biases they're not aware of. It's a lot of hurdles to jump over.
And I don't think anyone ever does it like maliciously, but I just think we've all had clinical experiences before where we're like, oh, would really rather not do that again. Sometimes that means that we end up being really conscious of, let me not be that clinical experience that makes people go, ooh, let's not do that again.
What not to do.
Right. I went into an appointment today and I was like, listen, I don't actually think I need surgery. If I could walk out of here and you say I don't need surgery, I would be super happy. But like, it's my spine and I kind of want an expert to tell me
of course
what the next step is.
I think you're describing an experience that a lot of patients find themselves in where they know their body. And like, I try to really validate them. Like, your body is telling you something. We should make sure we've ruled out scary stuff and manage the symptoms appropriately, right? You have a certain goal. Mm-hmm. I feel like the healthcare team's role or job is to support you in that goal and give you the safest selection of options that are reasonable and to the standard of care. Sounds too good to be true, right? Because a lot of the times the doctors are either saying you need to do this or this is going to happen eventually whether you want it to or not. And then a lot of people are left with feeling like they have no choice or they have no agency or say. I wish it weren't like that so often.
I think in a lot to do with what I've seen with people who also have spine injuries, you try so hard to get someone to listen that by the time you get to the fourth provider, you're already starting off like with your volume here because you're like, will you please just hear me? And then they're like, wow, it's a really loud individual.
Wow, they're really anxious and unreasonable.
Exactly. Yes. And so you like have to really be conscious of, okay, I'm reasonable, I promise. And it's something that I think anyone with an invisible disability is very familiar with.
It's so funny because my whole goal in life, I guess in my academic medical career, is to help teach providers how to not contribute to this vicious cycle that healthcare is in, with people feeling dismissed, not listened to, invalidated. It's traumatic. A lot of people don't want to go to the doctors because they know they're going to be mistreated, right? It's a terrible, vicious cycle. But there's not like an easy solution like, hey, just do these 5 things and you're going to be, you know, the best listener, the best doctor ever. Or it's like people can know, they can be told exactly, say this, not that, do this, not that, and still not fully get it. It's so challenging to say, okay, there's these infinity things wrong with the healthcare system and how we educate our providers. Let's get to work on that.
Right. You know, it's so much more complicated. There's so much more than just treat others the way you want to be treated.
Right, because then that ends up sounding really trite and cliche and in one ear and out the other. I mean, one way I've tried to get around it, if we are talking about sort of practical things that might actually make a difference,
Please.
I encourage people to ask their patients about something that's not related to health. So I ask, well, it's semi-related, but I'll ask like about someone's hobbies or like, what would you like to be doing more of if it weren't for these symptoms? You find out about people really enjoying knitting or hiking or grandkids, or, you know, you find out about their family and their culture. That humanizes things, and
Yes,
it's
absolutely.
harder to pathologize when you're like, this isn't the case of the back pain person. This is the lady who wants to get back to visiting her daughter in Colorado or whatever, you know?
I always love to know people's pets' names. That's my thing.
Yes, I put that in the notes. Absolutely.
If people can walk away with one thing from this, it's exactly what you just said. Finding ways to humanize your patients so that you're really hearing them and hearing their goals and what they want to get back to. I remember being asked one time, well, what do you normally take for your back pain? I'm like, I don't normally have back pain.
I had a whole life before this with no medicine.
Right, exactly.
I love that we're talking about the healthcare context, and that's where I think most of the need is to improve our understanding. Within the disability advocacy movement, within the disabled community, there's ableism there too, right? There's no space that's free of ableism, as inclusive as everyone wants to think they are. There's some levels of internalized ableism, or even having to prove that you belong. Is that the sense that I get sometimes?
Yeah, I am someone with a spinal cord injury who, at this moment in time, is usually capable of independent ambulation. And I think those two things don't always connect in people's heads. It's like, well, if you have a spinal cord injury, then you can't walk at all forever. It's like a binary state, right?
Binary. Binary. Ignition in 100.
And it's like, no, disability is really a spectrum. We have not so bad days, have bad days. We're really lucky every now and again we have a good day. Sometimes I feel perceived as like, but you're walking, you don't have a disability. I'm limping. It is taking everything in my power to be upright today. So I think giving each other grace to understand that disability is not binary is really, really important. You can't tell from across the room if someone has a disability.
And I think part of the spirit in the movement, I don't think it should matter whether you 100% are always identify with disability, some percentage of the time along the spectrum, or if you've never identified as disabled, but you still are passionate about the movement and believe in what it's fighting for. Out of any of the movements of marginalized identities, the Justice Disability Rights Movement should feel like the most accepting and inclusive of anyone. I think you and I have experiences where we haven't felt that. And that's okay. You know, no movement is perfect. But I think it's important to call that out and talk about it too.
The one thing that I love about our ERG is it's, you know, employees with disabilities and allies, ERG. I'll take a good ally any day of the week.
Yeah.
Like,
Don't
goes,
keep those people out.
got enough allies.
It's like, no, we're good. Thanks.
Yeah,
No,
we got
thanks.
this. No. I will take all the allies I can get. I like to tell the story of my dad. You know, I'm rehabbing from my first surgery, and it was really important that I wanted to go to the store for this particular thing. And we park in the handicap space, and I'm like walking towards the store, and my dad's like, so, do you think you should get one of those rolling shopping carts, like the mobility ones? I'm like, no, I'm not having that bad of a day. He's like, perhaps if you used the mobility cart now, you wouldn't have to have a really bad day, which you might have if you pushed yourself without it. And I was like, it's a really good point, Dad.
Good point, Dad. Yep.
And I used the cart, and you know what? It wasn't the worst day in the world. I'll love an ally perspective, because I think sometimes, I know I personally can get so focused on I will just push through this. I will just, I might be dragging my mangled carcass across the finish line, but I'll do it. Maybe that's not the best approach, Ro.
And I love the concept of how allyship can overlap with disability as an identity, right? Anyone in the movement could always consider themselves an ally to anyone else, regardless of their disability. Just because you identify with a disability or not, you can always wear that ally hat. And I think that's so valuable. And it helps grow our movement. It helps our movements stay welcoming and keeps the momentum building. I get really frustrated when people feel like they have to prove that they're disabled or prove that they belong or prove that they have a need. Of course, there's the discussion that people have to have with their doctors about what access needs or accommodations would serve me, right? So that's the problem solving that happens in a clinic. But then out in the world, or if you're on a panel or if you're in a work group or something, there's no need for that nitpicking of discussion. How disabled are you? I don't feel like that's a necessary part of the conversation most of the time.
Yeah, that's a yardstick that we don't need to use. Personally, super grateful for the program at Hopkins with the perioperative pain management program, because y'all took really great care of me when I had no idea what was going on. And it was just like unbearable, unfathomable quantities of pain. We have a program for that. It's like, oh, thank God. People metabolize things differently. And so being able to have programmers like, okay, we work with you with your plan. We get you through this. It's not just tunnel vision or just like one pathway.
And you felt like those providers were knowledgeable and empathetic.
Knowledgeable, compassionate, empathetic. Some of the most understanding and knowledgeable providers I've ever had the fortune to be under the care of. Because you come into things with your biases, and it's like you would have to be completely asleep to have never heard of an opioid crisis, right? To be going, but my pain is like, it is so bad, and normal doses of medicines wouldn't even touch things. And it's like, it starts to scare everybody, and the pain management people are like, nope, let's find what works for your body and let's go from there.
I love that. Safety first, right? Of course, in pain management, opioids are sort of the elephant in the room, but there's a time and a place for them. They're a tool, just like any other tool in your toolbox, and there's a huge stigma around them. But if you use them safely and appropriately, they can be a part of a successful program.
Right. And I think program is the key word there. It should not be the only hammer in the toolbox.
And don't they have like psychology and psychiatry or, therapy as part of the program as well?
They do. Because I think one of the scariest things about being in pain is thinking, what if this never goes away? And, what if no one ever takes me seriously and I never get relief? And it can really snowball mentally quickly if you don't have providers who are knowledgeable in that area and are like, we can get you through this.
I'm so glad that they were a helpful resource and helped meet your needs when you needed it. I can't take any credit from that, but I know those folks, they do an excellent job. So I'm just, kudos to them. I'm very glad you had them. And, it's funny how it's not like a groundbreaking thing, right? I mean, in some ways, yes, it's groundbreaking because many institutions actually don't have a similar program, but it's not groundbreaking in the fact that most medical institutions have the siloed providers with the knowledge needed, and all that really should happen is that they come together and kind of streamline the workflow. But sometimes an institution hasn't broken those barriers down. People aren't talking as much as they should.
As my surgeon was introducing me to these providers, I was thinking, this is a really good thing. Like, my surgeon did not get into medicine to do things other than surgery necessarily. This is why we have this multifaceted team. We have these interdisciplinary teams. I want the surgeon who got into this to do the surgery. But I'd also like the doctor who got into this to say, let's keep you from suffering in agony all the time.
Right.
You know,
And you don't want your surgeon managing your pain.
it's not what it's necessarily interesting to them. It's not what they want to do. And it's like, you do great surgery. Keep doing that. You know. So I felt really fortunate that there was that interdisciplinary team that you could get connected with. In my case, there was so much damage that had taken place over so much time prior to there ever being a surgery. That it's like, yeah, you did amazing surgery. And also still a bit of a train wreck in there.
In terms of disability representation and support at Hopkins, I feel like we've been part of a good shift of, okay, we're highlighting employees with disabilities. We're part of this task force that aiming to include disability representation in more trainings and education. Do you feel like there are things we really need to focus more on moving forward?
So it goes back to something that you touched on sort of at the beginning of our conversation of not believing that everyone just wants to like stay home and not do work, and that disability means that you can't do anything else. That's what we're trying to move away from, because again, it's that very on, off, yes, no, disabled, able binary state that I think it's very easy for people to get lost in that kind of thinking. And I think we're seeing a really positive shift in that we're able to go, okay, I am standing before you today, but I have a disability.
I don't know if we'll ever feel like we've won or no more work to do, but I agree. We should celebrate the wins and celebrate the progress.
I'm really proud of our ERG. I'm really thrilled that you're doing the work that you're doing. You have this unique path that you're on where you're able to thread a very challenging needle. You're a doctor. You are a doctor, but you're a doctor who sees that things can be done better. Who's not like, we're fine. Everything's fine here. There's nothing to improve. Everything's great. Why would you think there needs to be improvement? It's challenging to look at yourself and your profession and go, okay, maybe we could do better. I think you're doing an amazing job of being able to be someone who is in what probably at times is an uncomfortable position, but we could do better. And we need to do better. And you're doing it actively. And it's really empowering to people like me who are just like, I'm just going to pretend to be not in pain.
You do a lot more than that. You deserve a lot more credit than that. I really appreciate your very kind words. And I'm very grateful to have colleagues like you. That's one of the amazing parts of this position. As uncomfortable it can be to be a doctor in academic medicine and say, hey, we're not teaching our med students or residents about disability the way we should, like diplomatically showing ourselves what room there is to improve. But in this position, I've been able to connect with you, with people in the ERG, with people in Office of Diversity, Equity, Inclusion, Student Disability Services, like all these other sections of the university, the School of Medicine, and realize we have lots of great people, lots of great resources. And sometimes it's just a matter of like getting everyone together and just putting heads together and problem solving. So definitely that's been one of the most rewarding parts of this uncomfortable position that I'm in.
I'm glad. I'm just really grateful for you, Stephanie.
Oh, thank you. I'm grateful for you too. You're so kind. If you want to hear more conversations like this, hit that like button and subscribe to This Ability Clinic for more accessible and entertaining education. Thank you so much for watching, listening, and learning. See you next time. What else should we talk about?
Funny story about learning sign language. I was taking a sign class and, I knew the first day we were going to sign our name and introduce ourselves. And I was like, no, I'm extra. I have to also be able to sign my job. So watch lots of YouTube, be able to sign my name is Bro. And I said that I work as a nurse. Very, very delightful woman who corrected me and informed me that I had just introduced myself, that I sex bonded as a nurse because this is work.
Oh, this is sex bond and this is work.
Apparently, I feel like that may have been a colloquial term, but yes, this is work. This is a different type of work.
That's hilarious. A+.
Oh, yeah. Right. Like, okay, way to stand out.
That's hilarious.